Let's talk oral health, as dentists across the country have been swamped with patients trying to play catch up after missing appointments due to COVID. Joining us now is Dr. Jamie Laviola to help us figure out what our next steps are. Dr. Laviola, welcome to Inside South Florida.
Thank you. Nice to see you, Jason. So as far as catch up during this time period, the main thing is just getting back in. And some of the things that people were working on are not getting to complete before the whole COVID. I know we're still in it. Just getting them taken care of, and the sooner, then the less expense, the less investment, the less times you have to see me or your dentist, and just getting back to health. That's
right.
The goal.
Right. Better late than never, Dr. Laviola.
Absolutely.
We've heard a lot about gum disease being a warning sign. What is it a warning sign of, and how does it predispose you to other illnesses in the body?
Okay, so that question is pretty loaded, Jason, but I'll speak a little bit more on a broad spectrum. So if your gums are bleeding, and that means that generally there's something wrong, there's inflammation. It could mean that you have a local problem, that you may lose bone or attachment that holds the teeth in. And then if that's not the case, that means there could be something wrong with your body systemically. So there's 53 diseases that have been documented to have an associative cause, gum disease, with that other disease. And so it's important that we know what that is, because it could be an indicator of something else in the body.
Right. Stress is something we all experience, and now more than ever, with everything that's happened over the last 15 months, people are more stressed out than ever. How does stress and cortisol play into dental health? I mean, it's what I'm getting from you, Dr. Laviola, is that your dental health affects your overall health.
Absolutely. So you have to think that the mouth and the teeth, it's the beginning of the digestive system, talking, breathing, speaking, eating, all those things. So cortisol definitely is something that's going to not help, but it's going to raise inflammation. There's other inflammatory markers. And bottom line is that it affects your ability to eat properly. Sometimes you can't sleep or get into REM sleep. So you have to find ways to reduce stress, because it is an overall thing for your health, from the mouth all the way to the rest of the systems of the body.
With COVID really placing people in their homes, we saw an increase in telehealth. And did you see that yourself in your practice, more virtual counseling and virtual meeting with other patients? And do you think that that's something that can help dentistry?
So Jason, before COVID started, I was fortunate to work a little bit on a telehealth or a virtual consult. And we did use it. And the benefit is that somebody that maybe has high fear, or they want to get to know the dentist or the facility, I can have a conversation with them first, maybe get some information, and it just lowers some of that threshold of anxiety, gives me more information, and reduces the time when the patient comes into the office doing administrative paperwork, and gives me more time to give them a diagnosis. Ultimately, you have to come into the office to get a diagnosis or a description of the issue, and also a treatment plan. It's been around longer for telemedicine, but in dentistry, we have to see the patient. But it's definitely a great starting point. I plan to continue to use it.
It's a convenient win-win for both the patient and also for you, the dentist and the oral hygienist. Big misconceptions when it comes to dental health. It's something that we're in the dark about, right, doctor? We're told to floss twice a day, brush twice a day, but there's still misconceptions in regards to protecting your teeth, protecting your gums, and your overall health. What are those misconceptions?
There's a lot of misconceptions, Jason. The biggest one that I see is, if it doesn't hurt, or I don't see something wrong or feel something wrong, that there isn't anything wrong. And some of the largest treatment plans or things I've had to do surgically are people that were asymptomatic, and until I took a three-dimensional x-ray to see what was going on, we wouldn't have known. Just like some other diseases, sometimes cancer can be dormant. So bottom line is regular checkups are really important, and taking advice from your dentist if there is something that is seen in the diagnostics or the imaging, or to really look at it. And then if you have a question, get a second opinion. But the main myth is if you don't feel it or see it, or there's no pain, that there's nothing wrong.
Right. Well, we got to be proactive when it comes to our overall oral health. Dr. Laviola, where can we find you online to visit you and to be treated by you?
So I'm in Northern Virginia, and it's www.drlaviola.com.
Wonderful.
Think about that for a second, but
it's like memorizing your phone number. Sometimes you just have to. You got to like take a minute. Dr. Jamie Laviola, thank you so much for this great information in regards to our oral health. It's really important. I know I'm obsessed now. I got to get back into that chair with my dentist, because I'm one of those people who was
get back in touch, Jason.
Yeah, over COVID. Always glad to have you here on Inside South Florida. Thank you so much.
Thank you.